Good morning, everyone. I'm Chai-Z. Welcome to Heart to Heart. We are doctors presented by Sunway Medical Center, Sunway City. Thank you for joining us today in this morning. For those who are with us today, can you please leave a comment, say hi in the comment section. All right, let's see who are with us today. Okay, guys, it's 11 o'clock in the morning. It's never harm to do some finger exercise. Can you please say hi? And good morning. Wow, good morning. Kafai, good morning. Nida, good morning. Carol, good morning. Maureen, good morning. Thank you so much for joining us in this morning. All right, guys. We have been discussing a variety of health-related topics, and today we're going to tackle an issue that affects all of us, not only in Malaysia, but worldwide. What is that? That is obesity. Yes, obesity is a major issue globally, not just Malaysia. And did you know that in terms of percentage, Malaysia has one of the highest rates of obesity, not just in ASEAN, but in Asia. Yes, Malaysia has one of the highest rates of obesity in Asia. You heard it right, no kidding. It's not ASEAN, but Asia. So we're going to discuss a revolutionary option for weight loss without involving surgery. That brings us our topic today, which is ESG, Endoscopic Sleeve Gastroplasty. So before that, guys, the information that we will be sharing today, I'm sure it will help someone you know. It could be your family member, it could be your friend, or even your colleague. So please help us to click on the share button to share this FB Live out. You never know, you might help someone who actually in need of this piece of information to find their well-being, to find their health. So ladies and gentlemen, for those who will be staying with us until the end of the show, until the very end of the show, we have a little special for you as well. Towards the end of the show, we'll be asking 3 simple, super easy multiple choice questions for you to stand a chance to win 150 ringgit touch and go e-wallet credit. So please make sure you stay with us until the very end of the show. Now, without further ado, ladies and gentlemen, to all the viewers there, please, now we will bring in our doctors who will be guiding us through this insightful discussion. Who is he? He is Dr. Yong Karl King, a leading authority in this topic on ESG. Dr. Yong is a consultant gastroenterologist and hepatologist at Sunway Medical Center. He holds a certificate of completion training in gastroenterology and hepatology from the UK. He's a fellow of Royal College of Physicians in London and Edinburgh, and an honorary consultant gastroenterologist of Imperial College Healthcare NHS Trust, which is the UK publicly funded healthcare system. Guys, here is Dr. Yong. Please welcome Dr. Yong Karl King by sending him some flowers, loves in the comment section, will you? Dr. Yong, let's say hi to our viewers.
Hello. Well, thanks for joining this session today on a Sunday,
right?
Where I think most people will probably be still in bed or just coming out of bed.
Right.
But it's great to catch up here today to talk about this really important topic. And I can't think of a better introduction and immaculately presented first thing off to kickstart this topic on a Sunday morning.
Right,
so thank
exactly.
you very much, Chai-Z.
No, thank you so very much, Dr. Yong. And guys, we want to
Yeah.
make this as an interactive section. So if you have any question, we really have a world-class expert here. So if you have any question related to ESG, endoscopic sleeve gastroplasty, please feel free to ask your question in the comment section. All right, to start off, doctor, our title of today's topic is Endoscopic Sleeve Gastroplasty, revolutionizing weight loss without surgery. So maybe to start off, what is an ESG and why it is considered non-surgical procedure?
Well, I think this is a really relevant question. And first of all, I just want to make it really clear. If you look at the procedure itself, endoscopic sleeve gastroplasty, even the medical doctors that I've come across, they actually get it wrong. It's gastroplasty and it's not gastrectomy. Gastrectomy is a surgery, gastroplasty isn't. And that's the first thing. Look at the title, it tells you no gastrectomy means not a surgery. Gastroplasty is an endoscopic procedure we are talking about. That's the reason why this is not a surgery, has never been a surgery. So that's one thing I want to make it really clear. Because I've come across a lot of medical professionals, they even pronounce it wrong or even write it wrong because they haven't heard of it. So it's not a surgery.
I understand.
And that the title itself gives it away.
Right.
Essentially, it's not a surgery. It's not a surgery.
Right.
So,
Right.
And there goes. We have to say that this is not an invasive procedure, but it's a minimally invasive procedure.
All right. So I think a lot of us always interchangeably switching between procedure and surgery, which is now Dr. Young has made clear. Procedure is not a surgery. So maybe you can tell more about, walk us through what actually happens during an ESG procedure and what happened in stomach and how does it help person to lose weight through this procedure?
Well, a pleasure to do so. First of all, it's not a surgery. Again, I can't emphasize it enough because a lot of misnomers, a lot of misconception about this. This is done through general anesthetics, which means the patient will be put to sleep. General anesthetics, just like any other procedures where you feel nothing about the procedure. Once the patient has been put to sleep, where they have no feeling whatsoever, then I'll do the endoscopy, just have a look at the stomach and the small intestine, making sure that everything is nice and clean for a go ahead. Once that's done, then a special device and equipment will be attached to the camera, the scope. It will be inserted through the mouth into the stomach for this second part of the procedure, where I will then perform plication, is the word that we use. By layman's term, essentially it means stitching the stomach internally, where it's called full thickness suture, which means the needle will go from internal, from the stomach end, out of the stomach and back in again to form a pattern of suture where we can plicate and make the stomach smaller. Now, this procedure doesn't take very long. And there goes, I say that it's minimally invasive because it still involves a camera, it still involves an endoscopy, it still involves something sharp like a needle. But involves no cutting, is a completely organ sparing, which means no part of the stomach is removed, as per the traditional surgery where part of the stomach is removed or major operation. Once that's done, because I'll be doing this plication, multiple sets of those plication, the stomach will be tightened by me pulling on the sutures. And by that, it will reduce the size and the volume of the stomach. Not only it reduces the size of the stomach through sort of three-dimensional way that you can imagine, it's just reduction like that. It also shortens the stomach. Essentially, what we're trying to achieve is a much smaller volume of the stomach. We're talking about a reduction of, say, 60-70%, although it's been marketed at 70-80%. But a reduction of the volume of the stomach, we are essentially trying to reduce the portion of food consumption. Why? Because with a reduction of the volume of the stomach by 60 or 70%, for example, you'll feel full faster and longer because it takes longer time for the food in the stomach to actually get into the small intestine. As a result, your food consumption and calorie intake is reduced. So there comes another really important word. If you take nothing out of it today, this one word you have to remember: portion control. Patients will be able to have a portion control of what they eat. All my patients so far that I've done in London, and they basically say, well, I used to be able to eat this much, doc. But now, after the procedure, I feel full with half of it, or even less. So with portion control, there's no point at any point that I would mention that they won't feel hungry, because I didn't affect any of this in terms of the sensation to want to eat. But they actually feel full earlier, they eat less. So that's a really, really important point. I have to make it crystal clear that it doesn't affect their satiety, their sense of hunger, but it will teach them a new way of life to be able to portion control their food. And that's what we want to achieve out of this. We don't want to affect their appetite, no. We don't want to do all the work for the patient, but we are trying to teach them a new way of eating, a new habit, a new discipline, where they can take charge of what they can do to be able to sustain the weight loss. I use the word sustain, another key word here. You want to have weight loss, brilliant. A lot of people did try, they did have weight loss, for sure. But can you sustain it? So that's the other, sustainability is really important. And that's the reason why we are teaching them to lose weight, and they, alongside us, the healthcare professionals, our dietitians, will be able to help them to walk this journey, to be able to teach them a skill. Essentially, it's a skill and a discipline to be able to carry forward.
I understand. So this ESG procedure is it's not about to make the hunger away. Actually, they still have appetite to eat. So before we dive into what's the role that a patient need to play in the entire weight loss journey, let's watch a video first, and to put things into a better visual, what actually happened during an ESG procedure.
At Sunway Medical Center, we offer a modern, innovative, non-surgical and minimally invasive solution that's life-changing: endoscopic sleeve gastroplasty, or ESG in short. ESG is a bariatric endoscopic procedure, essentially a procedure performed endoscopically without surgery or cutting. The stomach is reduced in size by suturing, reducing its volume by 70 to 80%. This helps you to feel full faster, eat less, and lose weight safely and effectively.
All right, Dr. Yong. So that is the video about what is actually happened during an ESG procedure. And earlier, Dr. Yong did mention that a patient does play a role to change their lifestyle or even the way their eating habits. So what are the other things that a patient should do after have completed an ESG procedure?
Well, like you say, the patient does play a role, but I probably, I will rephrase that a little bit if you don't mind. I would say the patient plays a central role.
Central role, all right.
Essential and central role.
Why is that?
Well, we just mentioned that we are walking the journey of weight loss with the patient, right? Actually, everything else matters, but the patient matters the most. And why would I say that? Well, we are assisting by doing procedures. We have experts, we have our dietitians, so on and so forth, to help. But essentially, the patient is the main person to be able to drive this forward. We can help, but they drive this forward themselves.
Understand.
And with our assistance as well. Because after the procedure, one thing that's really important, in fact, I would say the most crucial bit, apart from the technical bit, is the patient. Because after the procedure, you can imagine the patient has lived with a stomach that size, original size, for a long time. And when we do the procedure, there's a reduction in volume. And when there's a reduction in volume, then you would imagine that they might have a bit of discomfort after the procedure, which I'm sure we'll talk about that later on. But they need to be able to follow very strict dietary advice.
I understand.
There is absolutely no point having the procedure without compliance to the dietary advice.
I understand.
And when we talk about dietary advice, obviously we give a lot of good dietary support from our dietitian. And if need be, they might need some psychological counseling as well. For some people it needs it, but not everybody does. They will need to be able to retrain their frame of mind and eating habit. Yes, they will feel full a bit sooner, but after the procedure, the first 6 weeks is crucial.
First 6 weeks.
Absolutely, yeah. So the first 2 weeks after the procedure, they need to focus on liquid diet.
All right, understand.
But of course, when I say liquid diet, you have a lot more guidance about that. I mean, our dietitian is expert in this. We have actually drawn out what liquid diet means because it's really important for them to have this counseling. Because after the procedure, there's a lot of swelling in the stomach and there's a reduction in volume.
I understand.
So at no point, after the procedure, during the first 2 weeks especially, that they should be chugging down on KFCs. They should be having 2 plates full of Hokkien mee.
I understand.
They cannot do that.
I understand.
They have to stick on liquid. That is partly for the success of the procedure.
I understand.
Right? And also for comfort. Imagine you stuff a whole lot of solid food with a stomach that's swollen.
Which
you
is
will
reduction in size.
Yeah, and swelling as well because it's after the procedure.
Understand.
And that's the reason why they will suffer from that. So symptom improvement by following the diet and for success of the procedure, because if you don't follow that, they're going to feel really unwell. They'll start retching, nausea, vomiting. That can actually lead to rupture of the sutures.
Understand.
Yeah? Then after that, the following 2 weeks after that, you're talking about puree diets, basically blended food, yeah? Puree food. And then after that, it'll be soft solid, and then for the next 2 weeks, and then a normal solid food thereafter. I mean, for those who really pay attention to what I've just described, which I hope a lot of you do, is there's a gradual increase in consistency of the food from liquid to puree to soft solid and solid. Essentially, it's trying to transition post-procedurally for symptom management of the patient, as well as the integrity of the sutures that are put in. So you can see how I say patient is a central bit here. We are basically assisting, giving them all the tools to be able to succeed in this.
Understand. So, no, I totally understand why Dr. Yong mentioned earlier that actually the patient plays an essential role in the entire weight loss journey, because you only meet the doctors or dietitian for 6 weeks, but at the end of the day, it's the discipline of the patient itself to follow the phasing transition period, all the different type of diet in order to get the best results. And before we dive into further, there's our comment actually is buzzing with all the questions from our patient. Let's our viewers. Let's take some of them. All right, the first question from our viewers is, how do you choose your patients?
Oh, fantastic! I think this should probably come a lot earlier.
Because I think most of our viewers who are interested in this today's session is really want to know more about ESG, whether they are eligible for this procedure.
Right. So that's a great question. I think, and that's really relevant as well. Who do I choose? Well, I don't quite choose, but generally I assess patients on individual basis. Number one thing, you won't hear anyone else mentioning about this. Everybody will give you a long list of criteria. You meet this, you are for ESG. Why I don't mention that in the first instance? Because I want you to drum into your head. I discuss with the patient because everybody will have a different set of expectation. We have to meet expectation. What is success to you is not a success to me.
True.
What is success to the other person is not a success to me.
Because everyone's habit is different.
Absolutely. And also their expectation is different. So I need to meet expectation.
Right.
So that's number one. Okay, let's go for the more boring bits, which is essentially the list of criteria. Okay? So there's no hard and fast rule, but this is generally a guide.
I understand.
I will see them and decide, essentially. Number one, the patient needs to be overweight or obese. I mean, in our Asian population, we are talking about BMI of 27.5 and above. But when you look at it, BMI is a very crude measurement. I mean, you have other ways of measuring it, which are a lot more technologically driven tests like body composition, etc., etc. But for the purpose of our discussion, for simplicity, BMI of 27.5 and above for our Asian population. But in the UK, I've been performing it for people with a BMI of 30 and above. And that's because that's the Caucasian scale is different. You can see a WHO definition. First of all, 27.5 and above, BMI wise. Number two, people who, this is also another important thing, people have tried everything possible within their power with lifestyle modifications, and yet they couldn't achieve weight loss.
What's that lifestyle modification? What are those?
Well, I said it's basically trying to eat healthy. People come up with lots of exercise. They've tried for a long time. And usually, I don't even ask them this question.
Oh, because they have already tried. You think because they have the heart, they have the intention to lose weight, so they most likely have tried all the options.
I've never ever come across somebody in my clinic where they say, I come and see you, I've never tried a single thing of it. They come and see me, obviously they have tried every single thing, right? Lifestyle measures, they join God knows how many gym membership and things like that. It didn't work. So they have tried, they meet the criteria of BMI, they have tried their lifestyle modification the best they could, they couldn't lose weight. And that is the main thing. And you should also be somebody where, with obesity related problems.
I understand.
Medical problems wise, yeah? We are talking about physical health and mental health. So physical health that is related to obesity, such as diabetes mellitus, which is high blood sugar, and high blood pressure, obstructive sleep apnea, high cholesterol problems, fatty liver. Actually, obesity also linked with a lot of cancer risk as well, which is often unquantified. Right. I say physical health. Then I'm talking about mental health. The mental health side of it is not something that is discussed enough, in my opinion. People who are obese, they try everything possible, they couldn't lose weight. They actually affect their self-esteem. And I've seen quite a lot of people with depression, low mood, etc., etc. So a lot of people with obesity who try everything possible, they have these other reasons, then I would offer them as a reason to be able to perform this procedure. And the other category are people who elect to have it over surgical options or medication options, or people where they are being referred to me by my surgical colleagues because surgery is deemed to be a too high risk, they would like to have this procedure instead. And there's also an emerging group that's coming in.
Which is what?
This is really exciting group actually.
Oh, is that right?
People who are already on anti-obesity medications.
Oh, okay.
So Malaysia is a bit behind in this.
Okay.
They've been having Ozempic, Wegovy, and Manjaro and all those things. Yes, they did have they have weight loss, but some of them have got side effects as a result. Then they resort to ESG, or people have had a lot of weight loss. Then they thought, oh gosh, I don't really want to be on this medication forever and ever. So
because
I would
those on medication will be for the rest of their life.
Well, a lot of it is easy to start, it's hard to stop. Because they want to curb their appetite to be able to lose weight. Don't get me wrong, they're a fantastic option. They're a really good option. But it comes a time you think, when should I stop? So then they want ESG as a belts and braces. They say, if you do this one, if it works for me, I don't want further weight loss. I just want to stop my medication. So this is an emerging group actually that I'm seeing in clinic as well.
And you know what?
Yeah.
When those who are obese and on medication, it sounds like will be costly because they have to take those medication for the rest of their life.
Well, you made a really good point because there was a study done in the US, I think Dr. Girapino and group. They actually look at the cost effectiveness analysis of weight loss medication versus ESG itself. What is really interesting is, but obviously they did some sort of really complicated, all way beyond my head, so statistical analysis.
Right.
I'm not a statistician myself. That's correct.
Let them do the work.
Yeah, let them do the work. We just digest the information at the bottom. The weight loss medication needs the cost need to come down by threefolds to be of same efficacy in terms of sustainability of weight loss and cost effectiveness as one ESG.
Oh, okay.
But this we are talking about in terms of cost, because a lot of people think, oh gosh, how much is this? Medication, 1 week or 1 month, this is how much it's going to cost. But ESG, this is the price, for example.
Right.
Then actually there is a study to show cost effectiveness analysis comparing them. So that's a really, really important point because the weight loss medication is trickling into Malaysia.
Right.
But actually has been available in the Western setting for a while.
Right. I think that makes perfect sense to me because, for the procedure, you probably do once and then you have to sustain by yourself for the rest of your life because you need to control your diet and just follow what have been advised by the dietitian. And for the medication, you actually can't stop, like what Dr. Yong just mentioned, what the analysis the analysis results has brought out. So you have to take the medication for the rest of life. It makes perfect sense if it is a longer time period that you need to take this medication. And let's continue some of the questions from our viewers. Actually, I think you kind of answered this question, but let's emphasize it. Because this viewer asks, will I be able to eat regular food again after ESG, or do I need to follow a special diet for life?
Yes and no. Yes and no. There are two parts to this question. Can you eat regular food again? Depends on what regular food you take.
True. If fast food is your regular food, okay, that is not so good.
That's why I'm really careful with questions like this because I get asked this a lot in clinic as well.
Right.
Regular food, not in the first 6 weeks.
Right.
Because, like I say, you have to follow a strict dietary, progressive consistency change throughout your diet. But in those, obviously, a dietitian will guide you accordingly. But after that, like I say, you have to take charge of your own sort of destiny post ESG.
Right.
Because the regular food will also mean you need to be having the discipline to stop when you need to. A balanced
diet.
A balanced, yeah. Because it's no point. And I did have patients. I'm just still sharing this with you.
Please.
It's really interesting.
This is what this session for. We really love to hear sharing from them.
They are a little bit cheeky, I would say. They say, okay, fine. You say liquid diet. They say period diet. I'll just blend my fried chicken.
Does it taste good?
Well, I've never tasted blended fried chicken before, but I doubt it. But I think when some people have that sort of craving, you have to be absolutely clear to them.
The creative.
It's really
the way
creative.
they make the food.
Absolutely, yeah. So if a regular diet is KFC, 10 chickens every day, then no.
I understand.
You cannot, you shouldn't. because we're teaching you a new way of life. So don't bend the way you eat or blend the way you eat, but just try to get onto the journey of a healthier living.
I understand. So no blend fast food, no blend, I don't know, blend ice cream.
Well, ice cream, it will melt on itself, and some people will probably just swallow that. It's not a problem. But an ice cream here and there wouldn't hurt.
All right,
I'm quite reasonable.
I think it's, the keyword is really balanced diet.
Balanced diet and healthy.
All right, and then a follow-up question from him or her: how long after ESG before I can eat normally again?
After 6 weeks. When you say normal, again, I want to emphasize healthy food and the solid food, but you need to know when to stop when you feel that you're full. You have to watch out your calories as well. So what I'm trying to say, many questions about this. I can see already a few questions about this.
Right.
You need to follow the dietary guidance that we give you. Healthy food, essentially. This procedure, I always say, is not a panacea. It's not a panacea for weight loss. It's not a magic cure. But what it is aimed to do is to help you to have portion control.
Right.
But you will still be like anybody else walking in the street.
Right.
You still get a sense of hunger, of course.
Right.
Because food gives us pleasure. It's a sense of pleasure, and I don't want to take your hunger away, but I just want you to control your portion.
Right.
Yeah.
I think it makes more sense now because you, Dr. Yong keep mentioning portion control.
Yeah.
So you just don't overeat.
Yeah.
And then when you feel hungry, you eat, but when you're full, you don't eat. So I think that will do the trick.
Yep.
Right. And then this is interesting. This is the first time I heard this term, sleeve gastric. Is that right? He was asking, sleeve gastric and sleeve gastroplasty, which one is safer?
Okay. Right. This question, again, I've been asked for years about this question.
All right.
Which one is safer? Well, first of all, you need to think about an indication. Indication means that what are you looking for? What sort of weight loss are you looking for? What sort of effect out of the procedure you're looking for? Once you've made up your mind and you think which one is better for you, because one is surgery, sleeve gastrectomy, and one is sleeve gastroplasty, which is an endoscopic procedure, which is what we are here to talk about. Once you made up your mind, you have what it takes to make a decision as such, then you have to weigh up the risk and benefit of both. So another punchline, keyword is risk-benefit ratio.
Oh, we all do. Doesn't matter if it's investment or...
Absolutely. Walking down the street,
right.
You have to analyze the risk-benefit ratio of being run over by a car.
Exactly. Right.
So when the car is coming,
it's not just
try to
ESG,
avoid.
not just on health or anything in life.
So when you make a decision which one you go for, you have to balance it out with the risk.
I understand.
Well, if you already made up your mind that sleeve gastrectomy is the one for you, then the risk that comes along with it, you balance it out, that could be a safer option for you. Safer, why? Safer in terms of efficacy and in terms of effectiveness, in other words, and the risk from it. Well, equally with gastroplasty. So I am not here to talk about surgery because I don't do the surgery. I don't do sleeve gastrectomy. Of course, when we talk about invasiveness, degree of invasiveness, I would say obviously sleeve gastrectomy has a higher level of invasiveness. When you talk about gastroplasty, it's a minimally invasive. So that point alone, I would say that that is actually a safer option, which is endoscopic sleeve gastroplasty. But you have to balance it out alongside what you're looking for, what effect you want out of it. So there's no real right or wrong answer. Of course, ESG has a really good safety profile.
I understand.
So it's a bit of a double-edged question, that one. So that's the reason why you need to speak with your healthcare professional to come up with an informed decision as such.
Exactly. I think what Dr. Yong has mentioned, the risk analysis is very important. And in order for you to do a good risk analysis, you have to be well informed. So you have to know what are the options on the table for you to go for which method is best suitable for you. So I think you made the right choice to be on our show today, so you can learn more about ESG and then you can make your right option, which method you want to go for. And then there's one more question that we would like to address. How painful is recovery after ESG? I think it's none.
Well, this one usually I address it firsthand when I see any patients.
All right.
After ESG, before I dive into that, I want to explain why you feel the way you feel. Most people have a same stomach configuration for many, many years. Now, with the sutures application, it's actually holding your stomach smaller. Imagine with that tightening, you saw the video earlier on. So your stomach will continuously trying to churn, right? Churn into your small intestine. That's how you digest, that's how you eat, and that's how you swallow. Imagine trying to churn something and pushing down food and continuously moving against a stomach that's held together by sutures. What would you get? You get cramps.
True.
Yeah. So that's one symptom.
Because it's really changing of the eating habit.
Absolutely. So you get cramps, you get nausea, and if sometimes some patients even get vomiting, but that's less frequent because nowadays we give them medications as well to combat that. And they get a bit dehydrated, they get constipation. So these are all the main things that I say you can expect to happen.
But that is only in a short time period.
Now,
right?
Yes and no. Some patients of mine had it for 24 hours.
Oh, that's very short.
Yeah, that's quite short.
Yeah. What do you think? Yes and no, I would think like, well, for months.
Well, that's yes.
But very small
The no
percentage, I guess.
can last for months.
Based on your experience, what is the percentage that will last for months?
Most of them will last for months. I can't give you an exact figure, but
Sure.
roughly about 10-20% or so.
Understand.
It can last for a few months. But
But
that,
less than a year.
yeah, I mean, the way they are also depends on how well you follow the diet.
True.
Because people will last for days. They essentially follow it to the dot. What we ask them to do. That's the reason why I'm not putting all the responsibilities to the patient.
Right.
We are here to help you to help yourself, right? So you need to be able to take charge. So we can't really control it 24/7. So a bit about us helping you, but you also have to help yourself. So it can last for a few days, and it can last for a few months.
Even as short as 24 hours.
Yeah. So this procedure. There's another term for it. Is called gastric remodeling. So you actually change the configuration of the stomach. It's called endoscopically remodel the stomach. And that's the reason why the stomach needs to be able to live in a new environment, new configuration. So you kind of expect this to happen. And some patients who have absolutely no symptoms, I doubt how well the procedure is done.
I understand. So it's in any time when you do anything related to remodeling, you would expect there are some changes in your lifestyle and your habit, right? Even if you remodel your house, you might need to move around your furniture. So I think it happens to our stomach as well. And then there's one question. I think this is a great question. Does ESG affect muscle mass if I'm eating less?
Okay, so ESG is meant to reduce your calorie intake, right? And people will lose weight. But again, it depends on your take and your discipline after that. If you just lie around after the procedure, not only that, you don't necessarily lose weight, you will actually lose muscle mass. But after the ESG, if you reduce your calorie intake, you go to the gym, you do a lot of exercises, high protein diet for example, especially after the procedure, you will build muscle mass. So it depends on the individual themselves. Because I think you probably will show later, I've had great examples of people after I did the procedure is almost unrecognizably in good shape.
Right.
Because some people actually take charge. They just need to get over the bump of weight loss. Then they take charge. They go to the gym, God knows how many times a day or how many times a week. They actually build a lot of muscle mass.
Right. I think Dr. Yong just mentioned he has some really good example in the past when he was working in St. Mary Hospital in London. And this transformation is absolutely fantastic. I think let's talk about it. One of the patients in London, I think. Shall we talk about that?
Yeah, correct. I've got some great examples actually. And,
just one enough because we only have 1 hour.
I know.
I know you have a long list of patients who has good transformation.
Okay. Obviously, I can't share any details, but anonymously is a young chap. It's a young chap, Caucasian chap. He was looking for a weight loss solution for himself. He tried everything. I think he has been going to the gym quite a lot. You'll probably see it on the screen as well.
But it is before the transformation.
Before transformation. But he was looking for a non-surgical option. There's a story behind it. He was looking for a non-surgical option because he had this post-traumatic stress disorder, PTSD, of potentially going to ICU after a surgery because of some historical reasons behind it. And he explored, and as with a lot of places at that time, they offer surgeries as a main option, and which should be so because there's been a gold standard of bariatric intervention, which is a sleeve gastrectomy that we mentioned in one of the questions, as well as a roux-en-y gastric bypass. But he wasn't that keen because he knows that the risk of surgery is not all that high, but there's still a risk.
Right.
There's still a risk. Nobody can tell any procedure of going to ICU, and that's quite reasonable. Then he was referred to me by my surgical colleague and say, can you have a look at this gentleman and think about doing an ESG for him? So I make it really clear to him what is expected and what was he expected after the procedure. And I must say that he had a very great outcome out of it, which was achieved through endoscopic sleeve gastroplasty.
Right.
And I believe he was very much an ambassador of the procedure and advocate for this procedure since then. And this was after our interview in BBC. I had the pleasure of talking in BBC alongside experience from this patient himself. So this is one example that I told him when I saw him in clinic. I said, well, actually, congratulations to you. I did what I can, my team did what we can, but you actually made this a success.
True, because you just mentioned he has done a lot of workout exercises and controls diet and everything. And guys, the photo that we just shown actually is not his the total transformation. If you want to look how he looks like right now, you can check out his IG. I personally can go and search his IG. He looks totally a different person. I don't think you can recognize him.
Yeah, I couldn't recognize him from his bag when he came to clinic and see me. I wasn't quite sure that was him, and until he turned around.
Right.
And even that, it took me 5 seconds.
Right. True.
Yes. Yeah.
and then, if you all want to know more about the information about what is the interview about on BBC by this patient, also Dr. Yong, you can search. The keyword search is a BBC Dr. Yong. You will find the information about the entire procedure.
I don't even know how to search, but good stuff.
Yeah, this is how the keywords BBC Dr. Yong Karl King. Then you will know you will have the news pop out in the Google. And then there's a few more questions. I think we should address them.
Sure.
We have one question from the viewer to ask if he has certain medical condition whether he can undergo the ESG. We'll hold on this question and then we'll answer that later. But I would like to get to this question first. He asked, or she asked, can I reverse it if I regret?
I think this one will bring us very nicely to the next part.
Right.
Let's talk about the advantages, and your question will be answered.
Okay.
The advantages of ESG is you can reverse it if you don't want it, and that certainly was a few cases in the States. And those patients actually had it reversed because they lose so much weight and a bit of malnutrition and some. But that risk is really low, 1 to 2% or so.
I understand.
It's reversible. In fact, this is one of the strengths of the procedure. It's reversible. You can imagine that putting all the sutures in plication, you can actually go in and cut the sutures. And whilst we are on this, because I'm sure other people will ask about other advantages, it's reversible and redoable.
That's exactly the next question.
I know. I can sense it. I can sense it.
Can it actually be done if I had other stomach procedures other stomach procedures before?
Okay, so it's redoable. When I say redoable, means that once you have had ESG once, many years down the line, if you gain weight again or sometime down the line, you can do it again. But if you have had a sleeve gastrectomy, which means part of the stomach is removed, and then you gain weight again, then that can be done on those patients as well. So you have had surgery, whatever that's left in there, because the other part of the stomach has been removed, and what is left in there can enlarge over time after surgery. If you weight gain again, we can do the ESG again. Not again, but doing it as ESG on somebody who had a sleeve gastrectomy. But it can be repeated in terms of one ESG can lead to another ESG. You might wonder, oh gosh, is that a failure? If you do one ESG...
In what situation I need to reverse it or redo it?
Well, you want to reverse it. Some people didn't expect that they have got a bit of crampy pain or nausea and vomiting after that, and they didn't expect to But this doesn't really happen. They expect to follow the dietary bit that we advise. Is that difficult? Then okay, you can go in and reverse it. But redo it, generally speaking, when they gain weight in the future. You might say, oh, is that the failure of ESG? Well, I would say it's a failure on all our parts. Us and the patient, perhaps.
Why is that?
Because perhaps we didn't do a good enough job to tell them what to expect and how our dietitians counseling may not have been the greatest. Perhaps it's a failure on our part or the technical side of the person doing it, or perhaps the patient has lost the discipline to be able to carry on with what is expected of them. So that's why I say maybe it's a failure on all our parts, not just the patient, it's probably us as well.
Yeah.
Having said that, patient's life journey is not just a plain mundane journey, right?
Right.
You have up and downs, right? I've had patients where after the procedure, they go through some sort of difficult times in their life, they start comfort eating, and then they'll gain weight again. Should they be offered another time? Well, I think so. If high blood pressure, you need more than one occasion to control your blood pressure. Diabetes, you need more than one occasion to add on multiple medications to control cholesterol problems and all those things. Why can't be ESG be offered more than once? So it's repeatable, redoable. It's actually meant to be a day case procedure. I've been doing this as a day case in the UK.
So that means I can go home right after the procedure?
Correct.
Okay.
But I appreciate there's some differences in regulatory bodies between the UK and Malaysia. But the procedure itself, especially the lower risk patients, can be done as a day case.
All right.
It can actually bridge to a surgery. Let's reverse that question you were asked. After surgery, whether you can have it, well, actually can bridge to a surgery as well.
Okay.
So what I mean by that is some patients, they actually have quite high anesthetic risk to be put to sleep.
I understand.
And then the surgeons may not be all that keen, but they need to lose some weight in the first instance.
Right.
Yes, they can go on medication, but actually they can have the ESG. Then when they are fit enough, they can go for surgery as well. So that's a reverse of what one of the audience questioned as well. So a lot of advantages, let's put it this way.
Right.
Safety, safety, safety. No one died from it. No one went to ITU because of this.
So you just mentioned that no one died of it. That means
Yeah.
that there's zero mortality?
It's zero mortality, zero ICU admission.
Wow.
Yeah.
And then can go home on the same day? And
Yes.
then when can they start working?
So real life examples, because when you go to the website, they'll say 2 to 3 days. I've had accountants going back to work the next day. Doctors going back to work within a week or so. I've had other professionals that actually, as soon as they feel okay, they go back to work, generally a few days.
Generally, a few days will
Yeah.
be
Yeah.
safe. Even though a construction worker.
Well, construction worker, I think if they're taking the jackhammer all the time, they might want to take it easy. You give it a few days.
Understand.
Or if they need to go and lift some really heavy weight, like lifting 300 kilograms, take it easy, I think, in the
I
first
understand.
instance.
And
Yeah?
I think that the key point here is really
Yeah.
follow the instruction given by the doctor or dietitian.
Exactly,
Right, so they
yeah.
will tell you
Yeah.
how fast you can get back to work.
Yes.
All right, I think that is all the important points that Dr. Yong has mentioned in the post ESG. Anything else that you would like to add?
I don't know if you will address this or any of the audience will ask this, but
Let's see.
I thought I might as well just mention this. After ESG, what is the total expected total body weight loss?
Oh, okay.
That's quite important, isn't it?
Right,
Most people want
but
to know
it's a
that.
bit technical for me to ask also, but it's good to know.
Okay, what you can expect with variation, because like I say there's so many different moving parts to this in order to move this vehicle. So we are talking about maybe what is documented is 14% total body weight loss. 14 to 7,
14%.
14 to 17, generally
Alright.
14 to 17%. But we are talking about variation here because a few things. Patients are different. Our body is made up differently. It's a lot more complicated than we ever know, our body. So everybody don't respond equally because the balance of fat deposition and our body's mechanism to control that is a lot more complicated than we understand. So on top of patient's compliance post-procedurally, it also depends on the body's makeup and how much weight loss they will sustain. You might think, oh, 12%, 14% is not a lot, is it? Well, actually, it does improve people significantly in the general well-being. So don't just look at this number, this percentage. Look beyond that, what you can do to carry this on.
And there is some intangible things like, for example, Dr. Yong just mentioned, it actually can improve the mental health. It's improve your self-esteem. There's something, is besides the tangible thing like the mass loss and all that, actually it's also some intangible values out of the ESG procedure. All right. So I think it's absolutely awesome and fantastic to know all the advantages that an ESG can bring to a table. Let's summarize it by watching this video.
This advanced endoscopic procedure does not require incisions, meaning no scarring and less time away. Most patients typically go home the same day as the procedure and can return to work in 2 to 3 days.
Alright, that is the video that summarizes all the advantages that we have out of an ESG procedure. And then that brings us to the next segment. Who are the ideal for ESG? But before that, we would like to address the question from this particular particular viewer. He mentioned, or she mentioned, can I undergo ESG if I have, I'm not sure how to say this word, but I will spell it. It is GERD.
Oh, I was waiting for this question from.
Oh, is that right?
I was waiting for it.
Sorry, I was holding
you were
this
holding
question
me too long. You were holding it too long. But it's great question, great question, because this has been a debate for quite some time.
Oh, is that right?
And I even asked this question to the expert in Spain as well.
All right.
No, if you have GERD, basically means gastroesophageal reflux disease.
Oh,
For the layman's term, is essentially what you call reflux. Yeah, gastroesophageal reflux disease.
I know it's reflux.
Yeah. Oh, thank God you know that. Yes, it's in fact a good thing to do this procedure. Why? Because I won't go too much into technicalities, but if you have a lot of reflux problem in the West anyway, I don't want to comment about surgical practice here, but in the West, they will avoid doing a sleeve gastrectomy because after they remove part of the stomach, it creates what we call a high pressure system. Then you get a lot of reflux.
I understand.
Again, I don't want to comment about the Asian practice, but in the West, they don't like that. Yeah. But that's because they cut the whole part of the stomach from the top to the bottom end of the stomach. You imagine it's a cylindrical shape. But ESG, we will plicate or suture, not the whole part. We only suture the middle portion. We are leaving the top end of the stomach untouched. And that's important. As a result of that, it should maintain the gateway between your stomach and the esophagus, which is a food pipe where food goes in. And that will not worsen any reflux, number one. Number two, as a result of the weight loss, it will improve your reflux because especially if you've got gastroesophageal reflux because of the hiatus hernia, as we call it, which is essentially part of the stomach being pushed up and cause this free flow of acid going up and down because of obesity, for example. When you lose weight, you get dragged down, and that will actually tighten that gateway and will improve reflux. So not only that you can have it, but it should, and in a lot of cases, can improve your reflux.
So in other words, it's kind of like an additional values and additional advantage because of the ESG procedure.
Yes, absolutely, yes.
Oh, that's fantastic.
Yeah.
So in speaking of, since we are on this topic, so let's talk about who are the ideal candidates first. We have mentioned those who have to be 27.5 in BMI, and then who are the other ideal candidates that can go for ESG procedure?
Well, in obesity, in the world of obesity and BMI, actually there's a way to classify how obese a person is. So you're class 1, 2, and 3.
Right.
If somebody is what we call class 1 obesity, which is just a little bit more than the normal BMI, like for example in the West, 30 to 35 is class 1 obesity, for example, and 35 to 40 is class 2 obesity BMI-wise, and above 40 is class 3. The ideal candidate is class 1, which is the lowest severity of obesity.
Oh, is that right?
Yeah, ideal, most ideal.
I thought it's the other way around.
No, most ideal.
Right.
But in people who are in class 2, for example, or even class 1, with other obesity-related medical problems like high blood pressure, diabetes, high cholesterol level, obstructive sleep apnea, which is a big problem. Those with really big neck and they start snoring and falling asleep midway through, those are really important because they will lead to heart problems if that goes on. All those patients with obesity-related medical problems and obese, ideal candidate. Now, that's not to say that people with obesity class 3, the severe ones, are not ideal, because they can also be helped to lose weight as well with this procedure. And they can achieve the same amount of weight loss percentage-wise. And especially now we know that you can actually combine ESG with weight loss medications. Yeah, and of course, the ideal candidate would be people who doesn't want surgery, obviously. Then they are left with medication or ESG. But now we know that you can put them together.
Right, I understand. And we have been keep mentioning is about risk analysis.
Yes.
You need to choose the option that is best suit for you. And what about those obese who would like to have children?
Yeah.
Do have an infertility problem?
So, generally speaking, people have been advised against pregnancy at least 12 to 24 months post-bariatric surgery in the West. But ESG doesn't have that much data to support that, i.e. how long after ESG you can get pregnant. But we do know one thing for sure. Obesity will not help with fertility, and therefore if you lose weight, plus minus any fertility treatment, it would help.
Oh, okay.
So with ESG, if people need to lose weight or somebody needs to lose weight, especially those from the reproductive medicine department refer along to me to help them to lose weight before they consider any assisted reproductive procedures or treatment, or trying to conceive naturally, I would go ahead and do it. Because you might say, well, okay, because of surgery, they need to delay, but you have the so-called, open and close inverted comma or biological clock. You can't really wait forever, right, to get pregnant. And also fertility treatment success rate will drop as you get older. So if time critical in a way, you need to lose weight, then ESG would be a good option. And in fact, whilst we are on this, I've had a patient in her 40s who had the, 40, 42, 43 years old. And her last child was about 7 years ago. I helped her with this procedure. She lost about, at that time, within 3 months, she lost about 10% total body weight loss, and she got pregnant.
So what is the ideal period that a lady can get pregnant after this procedure?
We don't have a lot of data to say when you can, but there's an Italian study that shows that for some reason quite a lot of them got pregnant after ESG in Italy. I don't know, but they didn't look at the specific pregnancy outcome.
I understand.
So there's no study like that. But they did look at the success and sustainability of ESG. It seems to be maintained even after pregnancy. So I don't have an answer for that because there's no study like that. But I do know that ESG have been shown to reduce weight, and therefore is a well-proven theory of improvement in obesity and improvement in fertility. But it's not even a doubt, is confirmed. Such a thing.
I understand.
But even if you get pregnant after pregnancy, after ESG,
right?
Even if you get pregnant, fear not, because you will then be able to be followed up very closely by our endocrinologist or the people of reproductive medicine, obstetrics and gynecology, because we want to make sure at that time to make sure your health, your general health and well-being is maintained, and the pregnancy as well. So even if you get pregnant, which you might do because of improved fertility, don't worry, because you have a lot of healthcare professionals, we have seen it before. It's not unique to this 1 or 2 cases. You might say, well, go for the least invasive option, go for medicine to lose weight. Well, I do know that my colleague in Imperial College is actually looking at ESG into improving fertility rather than medicine. Because all these weight loss medication, they don't really have the safety profile for people who want to get pregnant. So that restricts them to this being an option.
And also on medication, sometimes some medicine might have some side effects, right? So I think that is probably the reason why those infertility will go for ESG procedure. And
Correct.
and Dr. Yong just now have mentioned there's a lot of don't worry if anything happens during the procedure or post ESG procedure. There's always a team of professionals that will assist you. And I always believe that Sunway Medical Center has the greatest strength of Sunway Medical Center is its comprehensive approach, which now bring me to the next question. I would like Dr. Yong to explain to us the multidisciplinary team that Sunway Medical Center has set up for the ESG procedure.
Yeah, you're right. I think I use a lot of word we
Right.
because it's a team approach. It's not really a one-man show.
Exactly.
Right? It's not a one-man show. No one-man rodeo here.
Right.
So a one-man show won't lead to a sustainable outcome. You need a team. And yeah, you're right. Sunway is not short of health professionals in this regards, thankfully, right?
Yeah.
So when I talk about the team, you obviously have myself as the person performing the procedure, the person doing it. But the other team is a team of dietitians. Dietitian is so crucial that I would say that those were the first few people that I approached before I came back, because they actually ensure the success and trying to improve the success rate. Because without them, there's no point doing ESG.
Mm-hmm.
Because without them, I'm just going to be simply doing a procedure and the patient is set up to fail. So the dietitian is the other, I would say, equally as important team member in this team of ESG or bariatric interventional unit that we have. The other one is we will have specialist pharmacists, especially I talked about it a few times about potentially adding in medication. So we have specialist pharmacists. And this might surprise some people,
Right.
but actually we have psychologists.
Yes, it does surprise me. It does surprise because when we talk about psychologists, it's always
Yeah.
related to its role is always related to mental health.
Yeah.
What it has anything to do with ESG?
That's something that I actually brought on very early on when we started it in some way.
Oh, okay.
Because I said, well, all being well, we go and treat their stomach and ask them to eat less and everything else. Obviously, patients will try, but it's no good treating their stomach if you don't treat their psychological well-being.
Oh, now I understand.
Yeah.
Okay.
Well, you can eat. Of course, you ask them not to eat when they feel full.
Right.
But some people have the compulsion that they want to eat. That's where the psychologist comes in.
I understand.
But not everybody needs it, of course.
Right.
I mean, the psychologist will come in and give whatever advice and do the counseling. Why? You have to be prepared. Don't go try to deal with it when the problem comes. If you fail to plan, you plan to fail, right? So psychologist is really important, and I'm pleased that we have a psychologist or two in our team to be able to assist this. The other one is endocrinologist. Endocrinologist is really, really, really important because the endocrinologist in Western country, for example, they serve almost like the main medical physician as a gatekeeping to the obesity treatment, because they assess you as a whole, and then after that, whatever treatment that you need, perhaps try medication first, and then they assess all the other medical problems. And especially if they're diabetic, then the endocrinologist needs to get involved. The other team member is the surgeon, which I'm pleased to have in the team as well, because, at the end of the day, to manage obesity, you need a lot of team members. And not everybody will be suitable for ESG. I think people have to understand that, especially if their expectation is not matched with what is expected from ESG. Then our surgical colleagues can have counseling session about surgical procedures. So I'm not here to say ESG is the only way. I would say ESG is one of the way and a very good way to manage the obesity problem.
And one of the safer way as well.
Correct.
And then now I totally understand why the addition of the psychologist in the multidisciplinary team in Sunway Medical Center. Because earlier, if you remember, Dr. Yong did mention that after the procedure, you need to change your lifestyle. You need to change your diet habit. In other words, actually, it's all related to your mind, to your mental. So the best person, the best professionals to help you on this lifestyle changes, on all these dietary changes will be a psychologist, because he needs to guide you, to support you throughout the whole journey. So I think with that being said, let's summarize the entire multidisciplinary team that we have in Sunway Medical Center by watching this video.
ESG is also a suitable alternative for those looking for non-surgical treatment for obesity. But ESG isn't a quick fix. It's a start of a journey. After the procedure, you'll have to follow a diet plan supported by our dietitians. Where appropriate, anti-obesity medications may also be prescribed to support your weight loss journey. If you've been struggling with your weight and it's taken a toll on your health, please know this. You're not alone. A lot of us have been there. With the right treatment and comprehensive support from our team of experts, we're here to help you take that first step towards a healthier and happier you.
Alright, that pretty much summarized the multidisciplinary team that we have at Sunway Medical Center. And guys, after learning so much from Dr. Yong, now I think it's time for a quiz. Let's put what we have learned today into test. And of course, there's a chance for you to walk away with 150 ringgit touch and go e-wallet credit. Okay guys, here is how the quiz works. We will ask 3 super easy, simple multiple choice questions. And all you need to do is just type in your answer in the comments below. And also, before that, you need to clearly indicate or prefix your answer with the question number. For example, for question 1, you need to prefix your answer with Q1, then only followed by your answer. And for each question, Dr. Yong is going to pick a lucky number from 1 to 20, and then our backend team will count through the answer for that question. The person whose answer matches with Dr. Yong's lucky number will be our winner, right? For example, if Dr. Yong picked 18, for example, for question 1, then our team will find the 18th correct answer, and the person for that 18th correct answer will be our winner. So are you ready? Let's play the quiz. Okay, first question. Which of the following is not true about ESG? Alright, A, it's performed with sedation only. B, it's performed with a gastroscope and a special suturing device. C, dietitian counseling and diet plans are part of the treatment. D, it can be done as a day care procedure. Alright, please write your answer. Before that, Dr. Yong, what is your lucky number?
So I just
And one from 1 to 20.
1 to 20. Let's see. Well, what do I feel like today? Give me a 10.
Oh, that is easy. That's quite early, quite front. Okay, so the 10th correct answer will be the winner. So please put your answer again. It's not true about ESG. While we're waiting for our backend team to sort through the complete correct answer, let's answer some of the questions here. All right. The question here is, after ESG, can health issues like diabetes be improved?
Right. I would say that's the whole point of it.
Oh,
so after ESG, when you lose weight, especially things like diabetes, high blood pressure, fatty liver, high cholesterol levels, the point is not just cosmetic reasons. It's not only cosmetic reason that you do ESG. Is to improve all the other health parameters, and this is very well proven in multiple studies, including the landmark trial, MERIT trial as well, which was done as a multi-center study in the US. You basically have an improvement in diabetes. When I say improvement, it could be reduction in the dosage of medication you take, reduction in the number of medications needed to control blood sugar, or even come off the medication sometimes in terms of diabetes. Blood pressure equally, you can come off potentially. Cholesterol problems, and in fact, the other thing that it could potentially improve is when you have got sleep apnea, which is people snore a lot because of the fat, and as a result, risk to their heart problems and lung problems. That will also improve. So that's the whole point of doing this procedure, is to improve all the other obesity-related comorbidities. And I emphasize, this is not actually meant to be a cosmetic procedure. This is a medical procedure to be able to help people to manage their obesity-related medical problems. And that's the reason why this became such a big, important procedure in recent times. Because for the longest period of time, there has been a lot of fear about having invasive surgical options, and which were the only options.
Right. Right, they were the only option.
Yeah.
Now we have more options for you
Yes.
after today. All right, we got a winner, and the correct answer for question number 1 is A, and the winner is Inget. Congratulations. All right, let's proceed to the second question. Question number 2. What are the key advantages of ESG compared to other weight loss methods? A, minimally invasive and non-surgical. B, shorter recovery time. C, lower risk of complications. D, cost effective. E, all of the above. This is quite an easy question. So, because I will tell the story later. But Dr. Yong, let's pick a lucky number.
Okay, I'll take number 18.
18. All right, 18 number. Yat Bat is a lucky number. Because during my driving license time, when I do a theory, right, I was always told if you do not know the answer during the theory part of the driving license, you pick the longest answer.
Yeah,
that it will be more, the probability of getting a correct answer will be right.
Well, Chaji, don't derail.
Because it's quite easy. Yeah. All right. But yes.
my tip is don't listen to him.
Okay, so let's continue addressing some of the questions that we have from our viewers, and there's one question quite a number of people ask: how much is the procedure?
This procedure at this present moment in time, obviously, I can revert to our business management and our management team. It's at least 26,000.
I understand.
Ringgit for Malaysians. And the reason why we say at least is because it also depends on how the procedure is performed. And that, I believe, correct me if I'm wrong, I'm sure management will jump in if I say something wrong, is it also includes an overnight stay for majority of the patients.
Oh, that is really sounds like a max to me. It could be a range.
Well, it's a range actually, because we can't give you a definite figure, because for every suture that we put in, it costs money. You might say, well, doc, put less. Put less, I'll be all right. Well, you have to think
put less of the stitches.
Yeah.
Oh, really have patients ask that?
Well, yes.
Okay.
I have had real examples, people saying that. But you have to think about sustainability as well.
Right, true.
I tend to do it in a way that is sufficient and sturdy sort of suturing. I don't want to do half the work and charge you half the price, and then things won't be as sturdy as it meant to be. So that's one. That's the reason why we cannot give you an exact figure, but we can give you a minimum. So a normal sort of number of sutures that we do, that costs around about 26,000.
I understand.
So this is self-paying as well, which I need to say.
I understand.
This is self-paying, yes.
And I'm quite surprised with this figure, because earlier we did mention about the cost effectiveness, and then Dr. Yong did mention that based on the studies overseas, and for those who are on medication to lose weight, actually it costs much higher. I can't imagine. Maybe some of you who are taking medication right now can tell us actually how much it has been costing you. And remember, if you're on medication, it will be for the rest of lives. And then the procedure most likely just once. Of course, unless you want to redo it.
So the medication bit, you're right. A lot of people take it for a while. I wouldn't say that every single case, I wouldn't say every single case is for life. Right. But they might decide to stop it at some stage.
I understand.
And the worry at that time is thinking about rebound weight gain. Because some people have this, I'm speaking from real life experience, some people have this fear of stopping. They say, doc, I'm worried if I stop, I have this appetite back again, I'm going to put on weight. So it's one of those things easy to start, and with good reasons as well. It's really good medication, don't get me wrong. But the worry is about for how long when can you stop. So I wouldn't say they are for lifelong, but let's say if you take it for 6 months, you stop. Of course it costs less, but how about the risk of a rebound weight gain? True. But again, every single intervention is not 100% foolproof. It's not everything that you do will have the desired success rate. And I hold my hand up even for ESG, it's not the case. I wish that were the case, but it is not. It's not 100% success rate. But that's the reason why we need to ensure that we have everything it takes to make this a success as much as we can within our own capability and the effort that we put in.
All right, I think that's really all about the risk analysis, which method is best fit you. And then we got a winner for question number 2. The correct answer for question number 2 is E, all of the above. All right, and, yeah, don't follow my tips. It's wrong.
Yeah,
right, and then the winner is Jack Neural. Congratulations, Jack Neural. And let's continue with our last question. Which of this makes someone an ideal candidate for ESG? A, plus size with fertility issues. B, BMI above 27.5 kilogram per square meter. C, previous unsuccessful weight loss attempts. D, seeking a non-surgical weight loss option. E, all of the above. All right, let's pick a lucky number.
Right, okay, we already had 10 and 18. Let's give a 12.
12, alright. Okay, the 12th correct answer will be the winner. Alright, while waiting our backend team to sort out, to count through the answers. And let's answer 2 more questions.
The other thing is, sometimes the shortest answer might be the correct answer, isn't it?
Let me see. I'm not sure. Okay, let's answer 3 more questions before we conclude the session today. Alright, this is actually you have answered during our session.
Right,
Maybe
okay.
we just re-emphasize it. She asked, can I still get pregnant after ESG?
Yeah, so you might still get pregnant. So a few parts to it for the words that we use. You might get pregnant after ESG, which has been demonstrated for my own real life experience with a patient, as well as in Italy as well, the study. Can you get pregnant? I mean, you might still get pregnant, but can you get pregnant? Well, yes. But after that, you will need very close monitoring from the healthcare professionals, endocrinologists, obstetrics and gynecologists, and if you are talking about assisted reproductive treatment from them as well. So yeah, there you go.
All right, and then as a matter of fact, as earlier Dr. Yong did share with us that quite a number of your patients are infertility.
Yeah, I have.
They went for this procedure. Went for this procedure, not surgery. Went for this procedure because they are infertile.
Well, it's just not quite a number, but they're not meant. They were not meant to be. They were not meant to be fertility related. But what I meant was we were looking into this as a getaway card in terms of losing weight and achieving improved fertility. Because our endocrinology expert in Imperial College feels that this is definitely one potential option.
All right,
for those
and
patients.
then let's answer 2 more questions. I think you did share already, but let's re-emphasize it. Do I need to take extended medical leave from work after ESG procedure?
No, it's like we already mentioned, just a few weeks.
Yes.
Just a few days. Sorry.
Right.
But then if you're not feeling great, not feeling up to it, also depends on the nature of work as well. Then take a few more days.
Right. And last question before we announce the winner for question number 3: is there a risk of nutritional deficiency after ESG?
Yeah. So that question actually came out a few times with patients, real life patients that I see in clinic. Because you're not actually removing any part of the stomach. You're not removing that because the nutritional absorption and metabolism relies heavily on your gastrointestinal tract, from your mouth all the way to the bottom, especially the stomach as well. So no, I don't expect any long-term nutritional deficiencies. And I had this similar discussion with my bariatric surgeon colleagues at St Mary's Hospital in Imperial College in London, who had also had this brainstorm and discussion with the expert in France as well. We have not seen any. So good question, because that in comparison to surgery, you will need some sort of supplements.
Oh, I understand.
Yeah, but of course after ESG, you can take your vitamin supplements. There's nothing stopping you from that. But surgery is slightly different.
I understand. All right, we got our winner for question number 3, and the winner. Oh, by the way, the correct answer for question number 3 is E, all of the above, and the winner is Maureen Lam. Maureen Lam, congratulations. All right, congratulations to all the winners for our quizzes, and please make sure you DM or inbox us so our admin will get your contact details, so you will get the 150 ringgit technical e-wallets crowded, we will get you sorted. All right, Dr. Yong, it has been so insightful for the discussion today. Could you please share a final message with our viewers more about weight loss? What do they expect in their weight loss journey?
I mean, genuinely, I feel that obesity has been such a global issue, partly because it's lack of awareness, and also there's stigmatization towards obesity. And for a long time, obesity has been blamed onto the patients. But now, I don't know if all of you guys out there are aware, obesity is actually classified as a disease.
Oh, is that right?
Yes. Obesity is now coded and classified as a disease. And people deserve a second chance and not to be cast away in the society to say this is all your fault.
Right.
So anyone who feels that they are obese needs to own up to it. Don't be afraid. Come forward, seek medical help, seek medical opinion, because long were the days where the only ever treatment is just advise you to eat less and go and exercise, and if not, go to the other extreme, which is surgery. Those were the days. Those were long gone, those days. Now you have additional option. You have what we talk about extensively today, endoscopic sleeve gastroplasty, which I hope we have given you enough information to be able to seek consultation, and perhaps consider this as part of your armor to be able to help you with obesity management and losing weight. And also, you also have very good medications out there. Lifestyle modifications, medications for obesity, endoscopic approach like endoscopic sleeve gastroplasty and surgery, they are there to help you. This is a very good option, although not the only option. But especially if you consider doing ESG, come and talk to us. See if you're comfortable with our team.
Right.
And if you do, we can support you throughout your weight loss journey. And last but not least, there is an option of doing this procedure and then having the medication. Actually, that will also exemplify your weight loss. So if you wish to walk your journey of obesity management with us, we are here to support and we are here to help you.
I understand. Thank you so much, Dr. Yong, for your insightful, valuable expertise on this topic. And we have been keep mentioning the entire weight loss journey is not one-time fix. It's not one person, it's not solo, it's a team effort.
Yes.
Thank you so much once again, Dr. Yong. Your insight truly has shed light on the topic that affects every one of us. And to all of you who are watching, thank you so much for tuning in. And after this live broadcast, the video will be available for replay. And feel free to rewatch or even share it to someone who might need for this piece of information. And stay safe. Thank you so much for tuning in. Till we meet again in the next session.